Good afternoon. I want to thank you for participating in today's news conference. We hold these briefings to provide you an update on the ground situation in Haiti. It's a relief to all of us to note that the impact of Hurricane Thomas was not as immediately catastrophic as we all feared, particularly when we compare it to the hurricane that occurred in 2008 that slammed into the island. With respect to the hurricane last week, the most heavily hit departments were the South and the Grand Anse, creating important needs for food, potable water, and hygiene kits in these areas. A number of hospitals were evacuated along with thousands of people in vulnerable areas, but they are gradually returning to their homes or their camps. Initial assessments indicate that Haiti's agricultural sector was the most heavily affected, with flooded fields and major losses in livestock and crops. We have every reason to expect that widespread flooding has increased the risk of cholera spreading. The effects of this could become apparent through an upsurge of cases over the coming days. Before we get into the actual case counts, I'd like to take a step and put the situation in context for you. Cholera is a complex public health emergency under any circumstances, and certainly in Haiti, the hemisphere's poorest country, the problem is even more complex. The country's water and sanitation infrastructure was inadequate to begin with. Then in January of this year, an earthquake struck the nation, killing more than 200,000 people and forcing more than 1.3 million people into tents and displacement camps where they still live today. To make matters worse, the flooding and mudslides from last week's hurricane pushed rivers over their banks, very likely spreading cholera even further. So that is the context of the current situation. To give a historical context, the cholera epidemic that began in Peru in 1991 spread to some 16 other countries throughout the hemisphere, from Argentina to Canada, and as I reported previously, cases were even reported in Montreal and New York City. In Peru alone, it produced more than 160,000 cases of cholera over 6 years. At the time, Peru's population was about 2.5 times larger than today's Haitian population. Extrapolating from the Peruvian experience, one might expect upwards of 270,000 cases if Haiti's epidemic continues for several years, as did Peru's. As of yesterday, the Ministry of Health was reporting more than 9,100 cases, hospitalized cases, and some 583 deaths in some 240 communities. These include the 73 cases reported in Port-au-Prince. We expect these numbers to continue to rise as more cases are detected. As I've noted in earlier briefings, you may hear different case counts from different sources. Reconciling these numbers is an important priority for PAHO, and PAHO is supporting the Ministry of Health in doing so. Before the current outbreak, Haiti was in the process of improving its epidemiologic surveillance system, that system responsible for detecting diseases and monitoring trends in diseases. And this was initiated after the earthquake in January. The main challenge was, and still remains, integrating case counts from different health providers across the country, including non-governmental organizations like Doctors Without Borders and Partners in Health, as well as bilateral partners such as the Cuban health providers. To help the ministry better integrate these various sources, PAHO has mobilized experts in epidemiology to continue improving the surveillance system. This work also includes establishing reporting sites in all the shelter areas. As this work progresses, there should be more consistency in the numbers. However, I want to emphasize, as I have emphasized a number of times before, that the case numbers are not as important as understanding the underlying trends, and our top priority is treating the sick and preventing new cases. So what are we doing to prepare for the increase in cases that we expect? The answer, in short, is we're doing everything we can to save lives. In anticipation of the hurricane, PAHO pre-positioned cholera-related and other medical supplies in the major urban centers of the South and the North, Les Cayes and Cap-Haïtien, as well as Port-au-Prince and St. Mark, the epicenter of the outbreak. From these points, NGOs and other partners are able to pick up their supplies free of charge and distribute them according to their needs. PAHO's ProMess warehouses continue to distribute medicines and supplies to hospitals and organizations in 4 departments. PAHO has also deployed a team of experts to Port-au-Prince to help scale up the ProMess operations, this central warehouse where medical supplies are stored and distributed in coordination with Haiti's Department of Civil Protection. We continue to work with the Ministry of Health, NGOs, CDC, and Canada, among other partners, to get the needed supplies into communities and health facilities and to prepare for the expected upsurge in new cases. One final note. The UN Stabilization Mission in Haiti, MINUSTA, said recently that there was no objective reason to delay elections and that they are scheduled for November 8th. You may recall that originally they were scheduled for last February, but they had to be postponed due to the January 12th earthquake. From a health perspective, we at PAHO believe there's no reason to expect the elections to have a negative impact on the cholera epidemic. And in fact, the Ministry of Health is planning to use the occasion to disseminate prevention messages to the population that will help prevent the spread of infection. And certainly this was the case with our experience of the 1991 epidemic that started in Peru and spread throughout the region. So I'll stop there and take any questions. Thank you.
Go ahead.
Hi, it's Carol Pearson from the Voice of America. I have heard that the cholera cases were largely in the slums and not in the tent areas. Is that what you are hearing as well?
You know, we're receiving case reports from both areas where we are concerned that if you put too much focus on one area, like the resettlement camps where they have a distribution system, there's outreach in terms of clinical services being offered, that in the slum areas where people are living in homes and under very marginal conditions, we just don't want to overlook that. So we're taking a balanced, more comprehensive approach, I believe.
All right, any other questions?
Yes.
Carol, go ahead.
Yeah, I have some other questions. You had a little bit of time to work out the treatment team or treatment program. And how are you doing that? Have you decided on any kind of vaccinations for people in the Dominican Republic? Have you decided on saline solution treatment for the people in Haiti? How have you worked out who's going to get what?
Well, the overall treatment plan is based on technical recommendations that are in several documents that provide state-of-the-art approaches and management to the treatment of infected individuals. The question about fluid resuscitation that you alluded to is meant to be provided to those patients that become severely dehydrated as a result of not receiving fluids by mouth or the oral rehydration salts that are quite effective in preventing the disease progressing to a more severe presentation. If, however, a patient becomes severely dehydrated, then we treat the patient with fluid resuscitation, and this means starting an intravenous line and provided, in most cases, lactated ringer solution. And we are actively working to mobilize sufficient supplies, whether it be ORT, the IV tubing, or the lactated ringer solution that is indicated for severe cases. The vaccination is not recommended for individuals in the middle of an outbreak. It requires 2 doses. It takes another week after the second dose to confer immunity, so by then it's too late. So it's not really not effective or useful in the management of this current outbreak. So that's our current recommendation.
What about preventing this from spreading to the Dominican Republic, or since there's so many aid workers to other countries?
All measures, including the deployment of teams to the Dominican Republic to help them assess their current facilities to deal with possible spread of infection, that's being done. In the case of vaccination, there are limited global supplies at the moment. There are 2 providers of an oral vaccine that for each there's only 1 or 200,000 doses. So the question is who you give it to. And we know that the mitigating measures of hand washing, sanitation, and so on are highly effective. In fact, even during the outbreak with those small numbers of doses, one might consider giving health workers, for example, vaccination, and we don't. We don't recommend that. It's not needed as long as they adhere to these simple measures. The margin of benefit of offering vaccination is just not there to justify all the logistics and training and costs that go into that.
What are you looking at as the worst case scenario?
In terms of?
Numbers of people who are going to get cholera.
It's impossible to predict. I gave a simple calculation based on the Peruvian experience, but I must say it's really impossible to predict. We're doing everything we can to mitigate spread. So if those measures are highly efficient in Haiti, which is most likely not the case given the situation we knew before, it will be variable. So I don't think I'd want to project at this period of time. It would just be meaning doing some modeling, and we're doing some modeling actually to try to help refine our planning. How many IV solutions would we need? But I don't want to venture putting those numbers out without more science and more evidence.
Now, we have heard also that that the hospitals are not able to handle the number of patients who are seeking help. Is that what you have heard as well?
Overall, I think the capacity to deal with the patients has been stretched but sufficient. There were reports, for example, over the weekend of one hospital in Gonaives that had patients in the hallway. But we expect that. We expect patients to be treated in tents in hospital compounds outside the walls. That's something we're prepared to do. So the system is definitely going to be stretched. It's how flexible and how innovative people can manage the situation to ensure that when fluids are needed, particularly IV fluids and IV resuscitation for those most serious patients, that is being provided regardless if it's in a room or in the hallway or in the waiting room. Whatever space is there, it will be used to provide treatment.
And one last question, and that is, since this is a sanitation issue, there also has to be an education campaign going along with this. And what is being done in that respect?
There's a huge education campaign. We've deployed communication experts that are working on community messages in the local Creole language to ensure that families receive such messages and understand them, and then that gets translated into behavior. I mentioned that, for example, the election will provide an opportunity for a nationwide community message campaign. I happened to be on the northern coast of Colombia when the 1991 cholera epidemic struck, and I was there working, helping the ministry implement a polio eradication campaign, and we used the opportunity to use it as a campaign for hygiene. And it's basically, if you're going house to house, you can give that message and ensure that every family receives it. So in the case of elections, when you're actually trying to reach every individual to vote, that's another way of getting those messages to all the families.
Thanks, Dr. Andrus. Any other questions from people in the room? If not, we have some that have been emailed in or sent by electronic means. One is from Bloomberg News, who is asking, are there any signs that the hurricane has or will exacerbate the outbreak even more? And do we have any kind of projection about when this outbreak might end?
As I mentioned in my briefing, the hurricane definitely stretched rivers. Water is spread over the banks, and so given the fact that particularly the Artibonite River is a source of contamination and a source of infection, if those waters flood over the banks, then that would be a source of potential contamination of other drinking water sources. So that's definite risk that we're having to deal with. In terms of trying to predict the length of this outbreak, given the proven experience of reporting cases for 6 years, certainly that is something to compare to, and what we know about Haiti's infrastructure, it's likely that this is not a short-term intervention. We have to think about the long-term and plan for the long-term for a few years in front of us. So it's an island, and island epidemiology enters the picture, but it has a foothold. The bacteria has a foothold in the river system and in other sources of water, and it will remain, and it will be a challenge to control future spread.
Okay, and then another question is about urban areas. Melissa says, it seems like we've been successful in reaching urban areas, but how are we going to be able to reach remote villages with prevention and education materials?
Yes, that's a challenge that we have been working on to mobilize partners. No one agency, Ministry of Health, no one partner can reach everybody. So you really have to acknowledge the contribution that all the partners have, including the several hundred the non-governmental organizations working in communities, and to use them to the fullest extent possible. So we've been working with UNICEF and others to mobilize all those entities and be sure that they are working in remote areas. It's difficult and challenging, but generally if we can map it out as such, we have a fighting chance to reach virtually every village.
Thanks, Dr. Andrus. And then we have a question from Thomas Mall, the science writer for the Los Angeles Times, who asks, why were they so late in getting the clinic going in Gonaïves? Do we know what happened there, and do we know how many people died in Gonaïves?
I'm not sure the reference of that question. Is that in reference to the beginning of the outbreak or to what happened over the weekend with the passing of the hurricane? We do know that, as I mentioned at the beginning, we're very, very grateful, thankful that this hurricane wasn't as disastrous as it could have been, as we all feared. Particularly when comparing to the 2008 hurricane that hit Haiti. But having said that, though, there are isolated or focal areas that definitely received a lot of damage, and Gonaïves is one of them. And they were stressed to meet the upsurge in cases. The town was flooded, and that poses all sorts of difficulties and challenges to the response.
Okay, thanks, Dr. Andrus. And then we have a question from Jody Bernard, who says, given the difficulty of rapid distribution of safe water supplies, has PAHO considered the interim measure of promoting simple water filtration techniques that have been used in Bangladesh with layers of folded cloth? And if not, why not?
That's an excellent question, and I think in certain circumstances where that may be the only technique that would be worth using. However, in Haiti, we're very focused on providing chlorine tablets that would chlorinate the water, that would ensure all bacteria in the water are killed. With the filter technique, it does not, unfortunately, filter all the bacteria, so you're left with the false sense of security that the water is absolutely pure when it's not. And if it's highly contaminated water, then you can see the possible implications. So what we're doing in Haiti is definitely putting out a very strong message to ensure that the chlorine tablets are available everywhere. And that way we'll be reassured that the water is it has the best treatment given the local situation.
Okay, and now we have, interestingly enough, a question from the Haiti correspondent of the Associated Press, Jonathan Katz, who asks, now that cholera has been confirmed in Port-au-Prince, is an extensive outbreak likely in the capital? And what does the apparent uptick in cases in Port-au-Prince, especially Cité Soleil, augur for the future of the disease in Haiti?
Well, we know that before this, Port-au-Prince, for the most part, was a large urban slum with very poor water and sanitation conditions. So this is ripe for the rapid spread of cholera. We expect transmission to be extensive. I think that's the short answer, and we have to be prepared for it. There's no question. And so with the disruption of those very vulnerable situations and very poor capacity for ensuring safe water before the earthquake, and then having it disrupted with the earthquake and now subsequently challenged by the hurricane, we have to prepare for a large upsurge in numbers of cases and be prepared with the supplies, human resources, and everything that goes into a rapid response.
Thanks, Dr. Andrus. We have a question from Remy Moreno, who says, in addition to taking care of people who are sick with cholera and preventive measures such as environmental hygiene and sanitation to prevent propagation, is there anything else we can do as a preventive method? Are there any other preventive methods available?
I think I've summarized most of what we can do in this current situation. If we had worked on water systems some years ago and ensured that there were basically systems in place that would have improved sanitary conditions as they are today, that would have prevented much of the spread. But unfortunately, that's not the case, and right now it's focusing on those effective, simple measures that all families can be educated about and do the right thing in preventing transmission. Hand washing, safe water, chlorinate your water, and the hygienic and sanitation measures to ensure that human feces are contained and not introduced into potential water supplies.
Okay, thanks, Dr. Andrus. We have one more from Melissa, who says, do we know how people are being told how to deal with the deceased? For those that died in a facility, there probably are obviously systems in place, but for people who died in the community or in remote areas, are there specific ways to deal with dead bodies, people who died from cholera?
Most definitely, and we've deployed a few experts to deal with that, help the Ministry of Health, help the Haitian people manage dead bodies depending on culture. We know in Haiti, for example, there is a tendency to keep the deceased in the home, and there might be increased risk of contact that would allow for increased transmission. So the sooner the body can be isolated and taken care of appropriately, I think those measures of having the body stay in the home, which would lead to increased transmission, can be prevented. And we're on the ground dealing with this, particularly with local community leaders that have an influence on basically decades of behavior and culture.
Okay, and then one more question from Remy Moreno. You talked about the messages that have been developed for prevention of cholera. Are they going to be sent out to the most remote and poorest zones in Haiti as well?
Definitely, yes. Thank you.
Okay, thank you very much.